Hi, good afternoon. My name is Erica Tapia. I'm going to be your nurse for today. First thing we're going to be doing is washing our hands, performing hand hygiene. And thank you again for consenting for another assessment. Today we will be doing the head to toe assessment at this time. Can you please provide your name and date of birth?
Andres Coleman, July 11, 1989.
Okay, let me check your wristband, and it matches. Good. Thank you. So from a 0 to 10, 10 being the worst, this is for the pain scale. What's your pain at this moment?
0.
A 0. Thank you. So next thing we're gonna be doing is gathering all our supplies, and I have my stethoscope. I have my gloves. After the hand hygiene, we're gonna don our gloves at this time, and we're gonna start checking for his eyes. So his both eyes look symmetrical. Can you close for me? Open. Thank you. So they look, he definitely follows commands. They're symmetrical. Can you smile for me? So both sides are symmetrical as well. Now can you lift your forehead with your eyebrows? One more time. Thank you. So we're going to begin with the scalp at this time and making sure there's no lumps or masses or any type of abnormalities. And as I can see, there's none at this time. Do you feel any type of discomfort?
No.
Anywhere?
No.
Okay, so everything's symmetrical. There's no mass, lumps, or no type of abnormality. Then we will check for the temporary artery, which will be right here. Following to that is the temporomandibular joint. It's right on the mandible. So can you open and close your mouth for me? Do you feel any pain?
No.
There's no pain. So patient denies pain. It looks symmetrical, and there's no clicking sound as well. Next, we're gonna check his ears, and they look pretty pink. They're clean, and there's no type of redness or no drainage seen. Next thing we're gonna be doing is we're gonna cover one eye, and you're gonna follow my finger along the way. Okay, good. Now we're gonna do the next one. Can you please follow? Thank you. Okay, so he's following the fingers with his eyes, and that will be cranial nerve 3, 4, and 6. His peripheral vision is normal. So now with the pen light, we're gonna go and check if the pupils will constrict or not. So we will go along, and we're gonna turn it on. And yes, they do constrict. Now the next one, on. They do constrict. Now moving along his nose, there's no type of lumps. There's no redness, bleeding. There's no drainage. Do you feel any pain?
No.
Okay, moving along with the mouth. Can you please open your mouth? Okay, so mucus is it's pink. It's the gum shows no signs of infections or bleeding, and it's pink and moist. The uvula, it's in the middle. Can I see that really quick? Can you open and stick out your tongue? So the uvula is in the middle, and there's no signs of infection or any type of inflammation. Can you move your tongue left to right? Thank you. That will be cranial nerve number 10. Next, we're going to go to the neck and thyroid for palpation to see if there's any type of masses or enlargements. And as you can see all along, there's no type of enlargements, no swelling at this time. Then we're going to check for his carotid pulse. So we only palpate one side only, and we don't do them both at the same time. It will be on his lateral side of the neck. Then we go into the other one, and then we're gonna look for the lymph nodes. So the lymph nodes is you will find the posterior auricular, the preauricular in here, the occipital in the back. Underneath, you're gonna see his submandibular and submental as well. Underneath, we have the posterior cervical and supraclavicular here as well. Next, we're gonna see his diaphragm, so it's right on in the middle of his chest, and we will have his aortic point. It's usually on the right side of the intercostal space, so it's gonna be on his right. Then we have the left one. We have the pulmonic, the Erb's point, the mitral, and the tricuspid. Next, we're gonna check on his feet. Can you lay for me really quick, please? And we're gonna be checking for his posterior tibial, which is right under here on his leg. Then the dorsalis, which is on his foot. Dorsalis and tibial. We're gonna do this on both sides. And I do feel his pulse, and it's normal. Can you sit for me, please? We're gonna do now the lungs. Can you turn around that way, please? We're gonna percuss on both sides. And we're gonna check also for his vibration. Can you say 99?
99, 99, 99, 99.
Okay, so that is the vibration is symmetrically. Now we're gonna auscultate for any abnormal sounds. And I start off on his left and move along to the right. I go down, left, down, and right. Can you take a deep breath? One more time. Okay, so there's no wheezing or crackles heard. Now we go into the abdominal area. So on his abdominal area, we're gonna check to see if there's any abnormalities, any masses or lumps. His abdominal area is flat and rounded. There's no mass. Do you feel any pain as I go like this?
No.
Okay, so first we're gonna do the auscultations. All vowel sounds, all quadrants. So we start with the right lower. Okay, then we start off with percussion on all quadrants. And we're gonna go ahead and do the light palpation, which is usually about 2 centimeters in a rotary motion. And as I go along, please tell me if you have any pain or discomfort.
No.
Okay, now we do the deeper in all 4 quadrants, which is about 4 to 5 centimeters. Always looking for any masses or lumps, again in a rotary motion. Okay, now the liver is going to be located in the right upper hand portion of the abdominal cavity. The spleen sits in the upper left part of the abdomen, which is located behind your ribs and under the diaphragm. The kidneys are a pair of organs that are found usually on the posterior muscular wall of the abdominal cavity. The left kidney is located slightly more superior than the right one due to the larger size of the liver, which is on the right side of the body. Now to check on his knees and the legs for leg movement, making sure he's got there's no pain and they're all symmetrical. Okay, can you lift up your leg for me for 5 seconds? Thank you. Now we do the same with the left. Thank you. Do you feel any pain?
No.
Okay, do you have any questions or concerns at this time?
No.
Okay, so it was a pleasure. Thank you for consenting again for another assessment. You will be leaving your call light next to you. If you have any questions, and you can reach out to me, I will remain available. And thank you again for consenting.
Thank you.
Have a good day.
Have a good one.